Oh, this is Dr. Neil Flock, and I'm post-call, and I'm sitting here wondering about this admit and observe ridiculousness. What do you do on a dictation discharge when basically your patient has been in the hospital in the same room as someone who's been admitted, but they're being observed? Does their discharge form start on the day of their official admission, and those 2 days that they've been observed don't count? Why does it really matter? What really is the difference? Well, the difference is what you pay or get paid by the patient from Medicare. And basically what this is a lower level of care that Medicare wants to pay. So instead of saying and simplifying it and saying we're going to pay you at a lower level, they use a terminology that becomes very confusing, especially not only to doctors, eventually we understand it, but to the patient. They can be in the hospital eating a meal, lying in bed, receiving the same care that another patient is, but this is perceived at a lower level of care. So the terminology observe is used as opposed to admit, although they actually are admitted to the hospital. Now, the problem is that we doctors put up with this ridiculousness. It's absolutely absurd. It's confusing. It creates a tremendous amount of problems, and it's created a whole industry of people in the hospital that try to guess whether the patient should be observed or admitted. So this is another level of administration that is necessary to determine what level of payment these patients should be giving. So every day at about 4 or 5 o'clock, I receive several phone calls. We try to figure out whether the patient should be observed or admitted in the hospital. And this takes time. It takes a lot of guesswork. And the penalties can be very bad from Medicare if you kind of guess wrong. So instead of Medicare saying, hey, we're paying you at a lower level of care, and this is why, they want you to do the legwork, take the time, and then penalize you if you are wrong. So it's kind of, guess what I'm thinking? Oh, what's your favorite color? My favorite color is blue. Wrong, it's red. So the absurdity of this is one of the many things that goes on in medicine in the United States today, and it's really quite time-consuming, and it pulls us doctors away from what we should be doing, which is taking care of patients, not writing notes and at computers like this. So I wish the government would rethink what they're doing, but here we go, more absurdity. Please speak up and speak out, and maybe we can change things for the better. Have a great day.